elevated. Now it's my time to shine, yeah, let's go. Graduated, elevated. Now it's my time to shine, yeah, let's go. Major moves, power moves. Take it to the top one time non-stop. Gotta go, gotta flow. Take it to the...
Hello and welcome to PhD Hard Talk, Dr Jia. Thank you so much for your time and thank you for saying yes and wanting to have a conversation with me. I'm still in shock and excited. Could you please introduce yourself, what you do, and we'll take it from there.
Thank you so much. It's my pleasure to be here. I love what you do. So my name is Dr. Jia. I am a physician researcher, also a kidney doctor. And currently, I am an active researcher at my university, where I work a lot on improving outcomes for acute kidney injury. And at the site, I am also the founder of Publish MD, where I try to help clinicians on how to publish their research papers so that they can build their authority.
Brilliant. Thank you so much. So in terms of academia, as you've mentioned there, that you're still a part of this world as well as being a consultant working with the kidneys, which I'm excited to talk about.
Mm-hmm.
What's your take on publishing? Do you think we should be under duress to publish? Because with our journeys, they're quite difficult, especially when you're going through data collection and then also the storytelling of the data. And then knowing that, you know, I'm under pressure to finish my project, but I need to publish at least 3 papers to get a job. What's your take on that?
So when somebody gets into academia, it is really important to know what's the game, you know, the rules of the game. And we have to take it or leave it, because the rules of the game in academia is you need to publish paper to move ahead, to get grants. And so publishing is a currency of the research paper. Now, knowing that, then you reverse engineer it. So people who don't like publishing cannot survive. So that's the truth. Now, there are many ways to make it easier and better, less stressful. So that's the second conversation we can. But when you go into a soccer game or football, you know, the goal is to score as many goals and you win over, right? You can't be a soccer player and say, no, I don't like to dribble. I don't like to kick, right? You still have to score the goal. You need to know the rules of the game. Then you reverse engineer it.
I love that. But I don't know if you've seen on Twitter, a lot of my colleagues feel like it's unfair as PhD students that they have to publish, even though they know what the end goal is. They feel like they're under pressure. How can they manage that pressure to know that I'm in a football game, I need to dribble, I need to pass the ball, and I need to score? How do they manage that?
Oh, such a great question. So certain advice has to be thought, is this advice for the early stage versus middle career versus like senior? So a lot of times when you see things like Twitter advice, random advice, there's no nuance, right? It seems to be like blanket for everybody. When you're a PhD student, I think the goal at that time is not really to publish a research paper at that point, is really to learn all the foundational pieces. So that when you finish, you can be in academia, where now you learn, you know how to collect data, you know how to run the analysis, you know how to run the experiment, you can write the paper, you can finish a project, right? So in PhD is slightly different. When right now I'm in faculty. So faculty, the currency is different, where PhD, the goal is to finish, learn all the skills, and also finish my PhD project. So I never did a PhD because I did MD instead. So I don't know how much pressure, but I'm assuming that when somebody are pressured to do that, they have to like step back and say, okay, if I need to do that, what are the skills that I'm building, the transferable skills that I'm building, so that when I finish the project, that is my end goal.
Thank you. And I think often, and you are accurate in your response to say that it is a blanket response. So therefore, whether it's fit for purpose, then it becomes questionable. So my next question then is, what are the common mistakes that we make as authors when publishing our papers?
I think there are 2 sets of the part. A lot of people emphasize a lot, oh, you need good research, right? This study question must be good. Another one's like, no, it doesn't matter. As long as your writing is really good, then you can publish it. Actually, to get the highest impact research paper, you need both. If you look at the highest impact, you need good research question, you need good data. The bigger, the more data it is, the better it is. The more robust the study design, the better it is. Now, without the research, the writing part, not writing well enough to finish, to complete the story, then it goes nowhere. So you can have the best data in the world, but you never publish it, you never write the paper up, then you basically wasted 3 years of your time, right? So you really need to carry it over to get to the finish line, or else it's nothing, it's wasted. And so I think my message, the biggest mistake is not understanding you need to complete both sides to be good enough, meet the threshold, so that you finish the paper, then publish it. So understanding you need both sides of skills.
But often, as writers, we panic, right? And then on top of that, we have a sense of maybe competing with some of our colleagues. And that comes across. I mean, I'm sure you've reviewed papers. When you read certain papers, you're thinking, oh my goodness. And some papers you're like, wow, this is amazing. And some of them you can tell this has been, it's been rushed. There's no, direction. We don't know what the scope is. So what advice do you have for some of us who like to compete because we want our names to be out there, but there's no relevance to anything that we're doing?
So I think when it comes to writing, there's difference between, perfectionism versus reaching the standard. And some people, I've worked with people like that as well. They, in the team, you have multiple type of people. One who's like, oh, I need it perfect and beautiful. They take forever to finish it. And then another one is like, oh, no, can we submit it now? Can we submit it now? Can we submit it now? We will like to pull them back. And really it's coming to a balance, okay? So first you need to at least meet the standard, right? Competing, rush, think about the actual timeline. If you have such a bad paper and you're trying to compete and want to get it out as soon as possible, rejection is more costly. It's more costly because it takes more time. A major revision is a lot more costly than a minor revision. So sometimes people think about the short-term speed, right? You want to be efficient, but actually at the long term, it's actually much slower. So I think a point where how I know where I'm speeding too much is where when I'm reading and I feel like this is going to get rejected, or I would have to go through major revision, I will pause and say, no, I'm going to pause because I rather spend a little bit more time so that it gets better before I submit it. So I can't tell you what specific time. It depends on the research paper and your messaging. But as soon as you feel like the reviewers are not going to like this, reviewers are going to have so many objections about this point, I feel like nobody is going to understand. That's the point. Like, I think we need to fix this a lot more.
I agree with that. And I think often we don't read our work critically as well, even though we read other people's work critically. Just to add on to that, it's a double-edged sword. We're very sensitive to our babies, which is our publications essentially. There is that. And then in terms of academic medicine then, because this is your speciality, could you take us through that in terms of how it works and how it may differ from social sciences, for example, in your opinion? Just to educate the audience at home.
Absolutely. So physician researchers have a slightly different framework because we initially train as physician. So when we go to medical school, the goal is not to write research paper. The goal is to how to diagnose patient, understand how the body works, disease states, so that when you see a patient, you give them the right medication, you learn about communication skills, how do you talk to them, how do you counsel them, how to help them, right? So that's the clinical side. A researcher, completely different skill set, where you are trying to collect all the data, where a lot of times you don't actually need to see a patient when we are talking about database science research. Sometimes we do randomized control trial. Yeah, we do need to talk to a patient. And doing project management. These are not the skills that we typically learn as physicians. So first, knowing that being a physician is very different from being a researcher. When you combine them, we actually have to learn skills all over again from scratch, from the bottom. Like, yeah, it's not transferred. Just because I'm a physician doesn't mean that I can do research. Just because I do research, it doesn't go. So you actually have to learn both sides. And in terms of the actual career, I actually did an extra master's because I don't know science. I don't know how to do research. Okay, so that's one thing I need. I also had to learn how to write papers, write research papers. We don't need to do that as a physician. You don't see us writing a nice, beautiful essay. We just say, do this, diagnosis, do this, order this test. Okay, so in terms of the day-to-day activity though, okay, there are different groups of physician researchers. Some are pure physicians, okay, that they see clinic, hospital, they take care of patient. A very small group where they spend more time doing research and then less time doing clinical, which is what I am at. When I first started mostly seeing patient, then I started to switch to 75% doing research, 25% seeing patients. So that means maybe once a week I see my clinic, and then Tuesday, Wednesday, Thursday, Friday is research work. And then I rounded the patients 6 times a week, 6 weeks in a year, 6 to 8 weeks in a year. So that's kind of my clinical work is much less than a traditional physician. And then you have another group, they call it academic clinicians, where you do clinical work 90% of the time, or 80 to 90% of the time, and then 10% you find interesting cases. You're like, oh, that's a very good, interesting case. Let's write it up and republish. But they're not doing systematic data collection all the time. Maybe 1 or 2 cases here and there. Sometimes they write something called a narrative review paper. The equivalent of a narrative review paper is like a literature review in a PhD thesis.
Yeah.
Right, just one, like what's the scope of the field at this moment. So they are just doing secondary research where they're collecting papers and then writing a nice paper and then they publish that. So there are 3 main types of clinician who goes into academia. And then finally, I would say is that as a clinician researcher, those who do keep a little bit of clinical time benefits us, because we still go into medicine because we love taking care of patients. When we go do research, we'll still need that connection. I seldom see anybody who does not touch any clinical work when they do research.
Then I'm intrigued now. What made you decide that I want to be part academic and also still be in practice? I know you've touched on it in the last few sentences, but what made you make that decision? Was it the environment? Was it you that was your passion? What made you make that decision?
It's sometimes things are not really based on passion. It was, I always made decision directionally correct. I think that's the right step. So I went during residency training, which is like after medical school, you need to do the practical training, internship, residency. We did some few projects. Okay, I'm like, oh, that's really interesting. We are asking interesting questions and answer. But then I realized I wasn't very good at the actual science part. So I took the master's, wasn't great at it. In fact, when I completed my master's, I had 0 publications, and I'm like, oh, this is not good. So I kind of improve on it. And the better you get, the more impactful the better you get, the more you like the work. So the better I was able to do science, the more I love it. And so it was through the love, gradually through that, I'm like, oh, maybe research should be my path. Now, I did have kind of an idea of why I wanted to do research in the first place, a background, love, not like true passion, but I've always wanted to impact lives, okay? So seeing patient, you help them one-on-one only, okay? Maybe one in a group class, you can do a bit of coaching, maybe one in a group, okay? But in research, the impact is much higher. That means if your research or clinical trial works, you may potentially help 1,000 patients at one time. And so if if I can do that, I can scale my impact a lot more. That means I can touch thousands and thousands of patients' life a lot faster and within my lifetime. So that was kind of the rosy idea of what's at the background. But I sometimes have to pull back, like, okay, that's a beautiful idea, but let me see what I can pull off. So always I made my choices based on, okay, maybe this is the next step. I like this. Let me make the right step, just directionally correct. Never put too much pressure on whether this is the perfect career for me.
I love that, because I often ask that question in terms of the guests, and usually they always say it's the love and passion for it, and also impacting people's lives. So all of us have a similar drive and passion, which is the same as PhD Heart Talk, to touch more people in terms of the wider community. So no, I do appreciate that. And in terms of the next question then, being a woman and you're a physician and you're in research, you're you're a clinician, how does that impact your environment in terms of where you are? And with diversity and inclusion, because we've had that global movement, and we also have gender pay gaps. How did you navigate through that? Because all of us, we have different struggles. And I spoke to Dr. Shristi Singh, and what she said was, I had to find a louder voice in meetings just to be heard. But everything I said was still repeated by a male. So then often I had to call my therapist or my counselor, just to have a conversation to say, is this normal? Is this what I should go through? But she's from India and she's relocated to the US. So I'd love to find out about your journey being a woman, because I think we all need to hear a bit of how do we navigate through our challenges in the workplace.
So first is, I think what you're touching upon is presence, right? Presence in the meeting. And so this is a topic I actually think about and read about a lot, because as a 5'2" Asian who's so small, when I first went into as an attending, which means a consultant, I was talking to a patient. This is one example. I went to talk to a patient, taking history. A group of surgeons, tall surgeons, male, a group came in and just overtook my interview. That means they were rude. And so I told myself, and the worst thing is, I just put my head down and kind of scuttled out, went out, okay? And I told myself, I can never, ever let that happen to me. I was more angry with myself than the others. And so I replayed the scenario where I role play that what I'm going to say, how I'm going to stand tall, what I'm going to do if the next time this happens. And true enough, it happened again. And this time I actually did something different. I looked up, I paused. Pause actually has a lot of presence, I looked up, I paused and say, hi, I'm the nephrologist attending. I'm in the middle of interviewing. Do you mind coming back? In about 5 to 8 minutes, I will be back. I'll be done by then. And I pause, a heavy, heavy pause. Again, I looked at them, I smiled, say, oh yeah, absolutely. For the first time, I actually saw them bow down a little bit and move down. And so it is about all the subtle changes in body language, that how we carry ourselves is actually more important than all the little side things. So my thing about presence is you need to be heard, seen, and felt, okay? Heard, seen, and felt. So to be heard, louder voice is important, okay? So knowing how loud you sound, compare what people perceive how you sound is important. Just even understanding. Like I used to speak really softly. Then I realized, oh, actually I talk really softly. So I had to learn how to project my voice. So that's one. And number two, the way I speak as well, speaking too fast seems like I'm nervous. So I started to learn to pause.
Right.
To give that presence. Right. So I was just in like demonstrating what the pause gives a lot of presence. Second thing is visual, how you look. Okay. Unfortunately, we live in a visual society. Okay. When the figs, what do you call that? Those scrub wears, the fancy scrubs wear figs and all these were were really in a rage, I told myself I would never ever wear scrubs, okay? Because I will always wear professional. I'm only gonna wear like work clothes, okay? That I want them to see me 2 levels above, like more administrative, chief medical officer sort of look. Always wear a little bit of heels just because I'm very small, like the physical presence. I would never want to be confused as the medical student or the volunteer who's rounding the hospital. So that's why I kind of went 2 levels up of what people will see me as in terms of physical appearance. And then the final one is also visual, is when I'm on Zoom meetings, I will always have my face up. I never put a blank screen. And I always have my face, because you need to feel me, you need to see me to know that I'm there. And then finally, physical presence, no, like it has to be felt. It means that I tend to make my presence known, whether it being coming up with some ideas, right? When somebody asks, I would never be the only person not talking. You know, we like to scrunch and not give our opinion. I may give 1 or 2 opinions, but not talk too much. So these are kind of slight things and verbal and body language that I started to pick up as I moved up the ranks, and I think that had helped a lot.
Oh, I'm reflecting on my own journey as well, because I didn't have a voice. So the first time I ever sat in a boardroom, and I was like, and I remember the whole room, everybody's like trying to hear. They didn't say anything, and one of the regional directors, he pulled me into a room, and he's like, okay, I see you as my daughter, and I'm speaking to you like my daughter. You need to tuck the belly in, make sure the voice is out, sit up straight, let people see you, have eye contact, and speak like you want to be there. Even if it's a few words, say what you need to say. People remember you. Try that again tomorrow. So when I went in there, I was like, right, I am Noma Mguni.
Yeah. There's one more point I learned recently is sometimes the executive presence is not, is also the mindset. One very interesting mindset is when we speak to higher levels, we get into this idea of we want to impress them. So we're always trying to say things that impress them. And because of that, you can actually sense the dynamic, the different power dynamic. Instead, when you start going into the conversation as an ally, like I am speaking to my chief, like, I think this idea is great. And I believe that if we do this, that we can help everybody together. Really, you're coming in as an ally. The dynamic shift, the position and dynamic shift, like we are in together. And so they no longer see you as a subordinate, but it's like, yeah, I feel like we are in a win-win together situation. The mindset itself changes the whole body language, changes the tone, changes how we look, how we feel. So that's kind of one trick I use as well.
And in terms of what you just said there, I think it takes gender out of it as well. You become genderless, and when you become equals, because then you have that respect in terms of fine line. But please don't come for us. I've experienced it in terms of what you've said. When you come in and you're speaking, you're saying, actually, I can see the risk over there. This would work a bit better. However, what are your thoughts? Then you have that discussion. It changes the aura in the room. So thank you so much for sharing that, because I think also as PhD students, often we get into imposter syndrome. And we feel like we're not meant to be in that room, and then we panic. Even though we have the answers, then you can't construct your response or whatever you want to say, and you panic. So thank you so much for sharing that. It's beneficial to all of us, including me. So I appreciate you in terms of that.